everyone, and welcome to an episode of the Prime podcast series. My name is Brian, and I'll be chairing today's episode, where we will be discussing the area of mental health with Dr. Eithne Hunt, Dr. Samantha Dockray of University College Cork, and Dr. Griphin Baxter Chirambo of Mzuzu University in Malawi. So, before we get into today's topic, I was wondering, could you each tell us a bit more about yourself and your research backgrounds? Perhaps starting with you, Eithne.
Hi, Brian. Thank you very much for the invitation to join you and Samantha and Baxter. So I'm an occupational therapist by profession. Occupational therapy is often thought as a profession that supports people with physical disabilities, but in fact, occupational therapy originated by supporting people with mental health difficulties over 100 years ago. So the focus of occupational therapy is all about trying to support people to be well within their daily life and be able to do everything that they need, want, and have to do. So I studied in Trinity College in Dublin and worked for 4 years in an inpatient mental health hospital in Dublin, and then moved to child and adolescent mental health in Cork. And I've been in University College Cork teaching occupational therapy now for 21 years. Where most of my work focuses on understanding daily life for young people and supporting young people how to be well.
Thank you very much, Eithne. And Samantha, would you like to discuss your background as well, please? Thanks.
Great. Thanks, Brian, and hello, everyone. So I'm an applied psychologist, and I work in the area of health psychology and what we call biobehavioral health. And I'll explain a bit more about what that means. And that is to say that I try and understand health from all dimensions of the life of the person. So what might be going on in their biological processes of growth and development. So that might include hormones, brain development, as well as trying to understand how that happens in a social context. So in their family, in their schools, in their neighbourhoods. And how that might change across time. So how at periods of transition, as people move from being children to teenagers, from being in their teenage years to adulthood, how those periods of transition might influence their mental health as well as their physical health. And most of my research over the last 2 decades, I suppose, has focused on trying to understand how the physical processes and the mental processes interact and influence each other. So when someone has particular emotional states or experiences which evoke certain emotions, how does that change their physical health? How does that actually happen? What are the pathways? And then when they have certain physical states, so that might be physical illness, such as having a cold or a flu, or some kind of disease, how that might influence their patterns of thinking and therefore their mental health. So I've been at University College Cork since 2011, which feels a very short amount of time and a very long amount of time. And the research group that I work with there mostly do work with teenagers and young adults, trying to understand how their experiences influence their mental and their physical health.
That's great. Thank you, Samantha. And finally, Baxter.
Okay. Hi, everyone. I'm Griphin Baxter Chirambo. I work with Mzuzu University in the Nursing and Midwifery Department. I'm currently the head of department for Nursing and Midwifery Department for Mzuzu University. I'm a mental health nurse. I got trained in the University of KwaZulu-Natal in South Africa. And after that, I've been working with St. John of God. That's the Hospital Order of St. John of God in Malawi. So I've worked there for around 10 years since I joined. And then from there, I moved to college. So initially at St. John of God, I was working, first of all, in the hospital directly with clients. And then I moved to the college where I started teaching. And then from there, I joined Mzuzu University, where I've been teaching since 2009 to date. And currently, I'm also working with the Malawi EF Research Center, which is dealing with the EF research. So apart from teaching in class, mental health, where I do teach mental health nursing to my students, I'm also involved in research work with Dr. John O'Donnell in Malawi EF Research Center. Yeah, basically that's that. Thank you.
That's great. Thank you. So we'll just get into today's podcast topic, which is all about mental health. Well, what actually is it? So the World Health Organization defines mental health as a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn and work well, and contribute to their community. So mental health is much more than just the absence of mental disorders. It exists on a complex continuum, which is experienced differently from one person to the next, with varying degrees of difficulty, distress, and potentially very different social and clinical outcomes. With that in mind, I was wondering if each of you could, I guess, give your own perspective on what your interpretation of the term mental health is from each of your respective research backgrounds. Yeah, I guess we can start again with you, Eithne, please.
Sure. Thank you, Brian. And just to say, Baxter, I also worked in St. John of God Hospital in Dublin, so there's a connection there.
Wow, thank you.
Yeah. So for me, I mean, I really like the World Health Organization definition because it talks about more than the absence of disease or disability. So as I mentioned at the outset, as an occupational therapist, we're really interested in, are people able to do the everyday things that they want to do? And lots of things get in the way of that. And it might be a diagnosed mental illness, but there's lots of other reasons that prevent people from doing what it is that they need and want and have to do. So I think it's really important when we're looking at mental health that we're really thinking, okay, and I suppose I'm influenced, somewhat by Corey Keyes's, two continuum model in terms of, well, we might have mental illness, but somebody can be very well and flourishing in their life with a diagnosable mental illness, and somebody may not have a diagnosable mental illness and can be languishing in their daily life. So, the focus on subjective well-being, I think, is really important, but really just for me, it's very much, is this person able to do what it is that they need, want, and have to do in their daily life? Are they able to experience kind of fulfillment in their daily activities, a degree of joy, not that we can expect to have joy from the minute we wake up to the minute we go to bed, but, are they getting a sense of being on the right track in their life and able, to meet their goals, to function socially at a level that is comfortable for them, and there's no one level for that. So I love the World Health Organization because it's very individualized. I think it recognizes context, and Samantha's work is obviously all on looking at that interaction. So really not looking at the person in isolation at all. So yeah, that's it. I suppose officially within occupational therapy, the framework we would think about is a kind of a biopsychosocial perspective and an occupational perspective.
Okay.
Yeah.
Can I come?
Brian, can I come in there? Sorry, Baxter,
Yep.
did I just speak over you? I just want to say, Eithne, that was so eloquently put. I'm not sure what I would have to add to that. It was that World Health Organization definition, though, is so broad that I think one of the challenges for us as just individual people living our daily lives, for us as researchers, for us as educators or family members or community members is what does it mean on the ground, so to speak? So how do we do this in daily life, and how do we allow for the ebb and flow of both, positive moments and more challenging moments, and see that as that ebb and flow as part of a natural kind of expression of experience and emotion. And so people listening, and certainly all of us here and perhaps people listening, would be very familiar with that World Health Organization. And I think it's the guiding principle. Eithne, also, as you know, in applied psychology, that would be our guiding principle. And I think that the challenge for us, or what we should do next, is think about how to support people to understand that these are quite aspirational things that we're asking. And if we don't think about the context in which people are experiencing their mental health, then we do people a disservice. I remember some young people said, well, it's all fine and well for you to say that I should do this and I'll have better mental health, but it ignores my neighbourhood, for example, or it ignores my family situation, or it ignores the resources, the emotional resources I have. And I think that's for me, that's a very important element, as Eithne kind of flagged up. The context in which people experience mental health is as important as the individual experience. Sorry, Baxter, I did speak over to you. I'll hand the mic to you now.
No, it's okay. Can I come in now? Yeah, so just to add on what my colleagues have said, I also support the definition of the World Health Organization. However, I just want to add something to say. When we look at mental health, we also look at how someone is satisfied, living satisfactorily in the environment of their choice. So wherever someone is staying, are they satisfied with whatever they have done, they have accomplished in life, or they're able to accomplish? And when we also look at the mental health, we also look at these three components. That's the feeling, thinking, and action. So where we look at how does somebody think. Are they thinking positively with whatever is happening? And how are they feeling? Because the feeling and the thinking is going to generate the behavior, which is the action. So we look at the thinking and the feeling, and then how are they acting? Because there are a lot of things which would demand someone to act in a way to show that this one is mentally healthy or mentally unwell. So when we look at mental health, we look at these three components as well. That's apart from the definition of the World Health Organization. How does someone think? Are they thinking positively, or how are they feeling? And then how are they able to act based on the situation which they have faced? Yeah, so that's what I can just add on top of what my colleagues have said. Thank you.
That's brilliant. Thank you. So our next question then is, what are some of the signs or symptoms that someone may be suffering with poor mental health? So I'll hand it over to you, Eithne, again, and we can kind of keep it in that order, I think.
Yeah. I think for me, the hallmark response will always be that it's so individualized, and that one person's experience and presentation may be very different to another person's experience and presentation. So I think we need to really tune into what this person is telling us, how they are behaving in the context of their day-to-day life. And really be guided by that, because, and I suppose ask the person how they're feeling and how they're managing, and how do, if they're feeling in a particular way now or behaving in a particular way now, how does that compare to other times in their life? Equally, I think it's important to be able to get information from other people who matter in the life of that person. That may be parents, it may be siblings, but I think it's really important in healthcare that we're able to extend the view to see, well, who are the important people in this person's life, and who can tell us, respecting privacy and confidentiality, of course, but who can help us understand this person's presentation. For me, again, it all comes back to, like, is the person eating? Is the person sleeping? Is the person able to get up, get dressed, look after themselves physically, look after themselves emotionally, obviously at whatever is age and stage appropriate? Like, how are they managing in the workplace, in the school setting and the college setting? How are they managing in a workplace setting if they're employed? How are they managing their social relationships? Because we're all so different. Like, how I choose to live my life and my definition of what is healthy and well and desirable for me may be very different to somebody else. So it's definitely not a one size fits all. Of course, then if we are more thinking about mental illness, there are kind of clinical signs of mental illness that would be red flags for mental health conditions. So maybe if thinking is becoming very disordered, if there's hallucinations, if there's delusions, if there's significant changes in appetite, significant and enduring changes in terms of sleep patterns, they would be the things, from a clinical point of view that you'd be looking at in terms of mental illness. But I think for the majority of us, it's more about the ordinary stuff. Like, are we managing to be able to pull our resources together, to access resources to support us to do and to be in the context of our daily life?
Okay.
Yeah. So I might just hand it over to Samantha then. Do you have your own interpretation? Yeah.
Yeah, thanks, Brian. I suppose my interpretation is guided by both my discipline of psychology, where we have very clear guidelines about what mental health is, and many of those things Eithne's already indicated. So change in behaviours, change in thinking, change in abilities to move around, kind of and do the things of daily life, as well as, kind of looking for or asking the person or observing kind of disorders or dysregulated thinking or emotional regulation and those kinds of things. And it kind of, I just want to come back to what we mean by mental health. And so we can describe what can be quite an aspirational or what is flourishing. So in some contexts, we'd say the idea that someone would not be depressed in this context, let's pay attention to that. So I think for many people that I might have had contact through research or in applied settings, I think one, it'd be remarkable that they had positive mental health given their circumstances. But we can also see people who have a drudgery of daily life, who there's not necessarily a change in their sleeping or in their thinking or in their positive emotions or their negative emotions. They're moving through life, but without perhaps high levels of joy or accomplishment or motivation. I would see those as indicators of someone who needs support to move towards flourishing. And that wouldn't be a definition necessarily that all of that across the discipline of psychology would be held. But for me, on top of all the other things we would want for people, it's for people to live lives where they are flourishing, where they have positive mental health, not just as we talk about that World Health Organization, the absence of mental difficulty. But we would look for the signs and the symptoms that Eithne has already described, a change in typical behavior or certainly a reduced capacity to deal with the slings and arrows of regular life.
Yeah. Yeah, and just to add on what my colleagues have said, when you look at the signs and symptoms of mental illness, I think that was the question. First of all, as my colleagues have said, this should be individualized in the sense that mental illness, okay, first of all, we can look at an individual, but also on a societal or cultural perspective, in the sense that what one might think it's an illness or it's a maladaptive behavior might not be seen to be maladaptive behavior in another context. If we look at an individual, what they perform, for instance, I'll look at having hallucinations. Hallucinations are said to be one of the symptoms of mental illness. However, for instance, in the Black African community, we have some other traditions where if someone is hearing voices, they feel they are talking to ancestors. And at that particular point in time, you can't tell that person that is having mental illness, because in that context, they are looking at it in a positive way. So what we are looking at here is this has to be individualized in the sense that there are some other symptoms which might be said to be symptoms of mental illness in one context, but in another context might not be. Now, when we look at again the signs and symptoms of mental illness, for us to know that this person is having mental illness, first of all, we have to look at that person as having thinking or perception deviating from normal. What people regard as normal is not what this person is in line with. Because, for instance, when we talk of the delusions as well, somebody might say, I'm having this high profile in the society, when other people, they don't regard him as such. So in that circumstance, we might say that this person is having mental illness. Yeah. So I usually give examples again of walking maybe without clothes. When you go to the lake, you'll find a lot of people might be walking, putting on their bikinis because it's at the lake, and nobody can regard them as having mental illness. But then when you go to upland, this will be totally be regarded as having mental illness. So this has to be looked at as an informal of an individual as well as the society, where someone is doing things outside what the society norms regard as normal. So that person will be seen to be having mental illness. So it's not cross-cutting that generally doing this will be mental illness, or doing this will be outside the normal aspect of a human being. I think I can put it like that, just to add what my colleagues have said. Thank you.
Thank you. Yeah, I think
Can I
that's,
just say,
yeah, absolutely.
oh, Brian, I was just going to say, Baxter, I think that was such a wonderful reminder about the need for cultural competence and, thinking about literally the culture that the person is in and being of that culture, whether that's in research or practice, and having an understanding of the context. And that's a crucial thing that that I think certainly in research there needs to be more of when we try and understand mental health and mental illness across countries, across cultures, even across generations. What is the context in which the person is operating? I think that's such an important reminder that you've given us.
And it's very much framed within a Western kind of developed society perspective, which, it's just such an important reminder. Baxter, I think it's brilliant. Yeah.
Yeah,
Thank you.
absolutely. I think as he said, context and subjective, individualized, tailored approach to signs and symptoms is extremely important. So just moving on then to some of the risk factors for developing mental illness. So the Mayo Clinic has a few they've mentioned. I might just mention, and you can build on that then. So a history of mental illness in a blood relative is one. So an inheritable aspect. Stressful, traumatic life situations such as financial problems, loved one's death, or experience in military combat is another one. An ongoing chronic medical condition has also been shown to be a risk factor. Brain damage as a result of a serious injury, so a traumatic brain injury, has also been correlated with mental illness. The use of alcohol or recreational drugs, childhood history of abuse or neglect, previous mental illness, or finally, few friends or few healthy relationships and social networks. So I'll hand it over to you again, Eithne.
Yeah, I mean, that's a pretty comprehensive list, Brian. And I think it speaks to the complexity of the issues that we're talking about. When I was in college, what I found most helpful in terms of trying to understand mental health, mental illness, was what it was written up back then for in the literature I was looking at, was the stress vulnerability model. So looking at what are the vulnerabilities, and we can also think about predisposing factors, precipitating factors, perpetuating factors, and then protective factors. because again, it's about all of these things come together. Somebody may have horrific adverse childhood experiences, but for some reason they've been able to access inner resources and external resources that have buffered that, and they are well and they are flourishing. Somebody may have a very privileged, upbringing and experiences, not have any obvious traumas, and they go on to experience challenges. So it's this interplay of factors that I think is really important. And so as an occupational therapist, we look at person, environment, and occupation. So the person factors can be within the person in terms of biology, and some things that you talk about, obviously there's a significant school of thought that mental illness has a genetic component. Equally, there's a school of thought who wouldn't agree with that. There's a school of thought that it's biochemical, and they wouldn't support ideas around maybe adverse childhood experiences, although that is gaining so much more traction now, and the scientific understanding of the impact of that is becoming much more kind of robustly interrogated. But I just think, you could look at a classic set of risk factors and somebody may be flourishing. So it's all about the interplay of all of these things, I think. But particularly, we need to also look at buffers and the protective factors. One of the quotes I really like to use in different talks is from Michael Ungar, a Canadian social worker, and he talks about resilience. And even I know the word resilience can be contested, but he says it's not a DIY endeavor. So we need to see and understand mental illness not just as this person, but this person in the context, as Baxter talks about and as Samantha talks about, in the context of their temporal context as well. I think where they're at in their lifetime, in their life story, and then just in their everyday context. So it's just extremely broad as I see it. But the 4 Ps I find really helpful.
Yeah. And Samantha, have you anything to build on that, or is your own interpretation?
I feel like Eithne covers everything so well. I feel like, what could I add to that? But I just wanted to talk a little bit about psychology and the research in psychology that, for decades and decades trying to understand, well, one, we've had a focus on what went wrong. Why do people experience these difficulties? And in all those decades, and with all the research effort and hours and interest in it, we are nowhere close to explaining why some people experience mental health difficulty and other people don't. Why is it that some people can have the same set of circumstances? So we think about adverse childhood experiences, a family history, trauma, being put under stress, and one person will be more or less okay, and the other person will experience significant difficulty.
It's not me.
Samantha's just frozen.
Yeah, I think Samantha's Wi-Fi is after.
Sorry, yeah, I'm back. I'm not sure where I cut off, Brian. I was just going to say that in psychology, we say like, well, we're happy if we can explain 30% of the variation between those people. So we are so far from being able to say, well, this is a recipe for mental health flourishing, and this is a recipe for mental health illness. And there's so much still to be known.
Okay. Yeah. So just to add again to what my colleagues have said, when you look at the risk factors of mental illness, literature tells us that genetic predisposition is one of the major issues. So maybe as I'm talking about genetic predisposition, maybe I should also go back to what my colleague talked about the predisposing factors, precipitating factors, and perpetuating factors. So when we look at these three, all the risk factors are grouped into these three. And she ably also explained about the stress vulnerability, where somebody can have protectors, basic vulnerabilities, and stressors. So now when we look at these risk factors, first of all, I talked of the predisposition, genetic predisposition. In this case, that's where we're looking at human beings as having different genes, which we obtained from our relatives. And those genes, nobody knows what gene they are carrying, whether we are carrying a gene of mental illness or not. And that on its own possibly also explains why some other people can suffer from mental illness and others not, both of them exposed to the same stressor. Because you might find that we are both exposed to the same stressor, but your friend is suffering from mental illness and another one is not. So we look at the genetic predisposition. At the same time, we look at the protectors, whether what somebody has and another person might not have those protectors, which can cushion or buffer that person from not having mental illness. Being exposed or involved in the substance abuse is also one of the risk factors. Just as the genetic predisposition explains, you'll find that some other people have been taking drugs all along and yet they are not suffering from mental illness. But another person just starts taking drugs, within a short period of time, they have mental illness. So it also goes back to how you are predisposed and what protectors you have. The other risk factor, which literature also tells us, is about our childhood, how we have been brought up, with the families in which we have been brought up matters a lot in terms of whether we're at risk of mental illness or not. What about the parents? Before we are born, maybe the mother was taking a lot of alcohol or smoking a lot, and that also possibly affected the fetus. And as the child is being born, is delivered, the child is also already exposed to those drugs or toxins, and that can affect the mental health of an individual. Trauma is also said to be one of the major risk factors, because in this trauma we might have brain damage, and with the brain damage, definitely the brain might be affected. Currently we have the HIV. HIV, being exposed to HIV, viral load in the brain can also affect someone's thinking and in the end suffer from mental illness. So there are a lot of risk factors. Delivery, how somebody got or was delivered at the time they were being born. Some people maybe they had problems. They took a lot of time to come out, and at that particular time, they felt it was time for them to start breathing the air outside, and then because of some other problems in delivery, somebody took some time. So the brain was denied of oxygen, and that can also affect the child. Yeah, so we look at a number of things. Epilepsy, status epilepticus can lead a child or a person to suffer from mental illness. You know, in status epilepticus, it means somebody will be having seizures time and again, and that on its own will affect the brain functioning. So mental illness can ensue. Yeah, so basically, I'll look at the risk factors as enormous. The number of them, which maybe we can't explain all of them. Thank you.
Yeah, thanks very much, Baxter. Yeah, so I believe Eithne has to leave now, but thank you very much for your time so far today, Eithne. It was great hearing
and thank you for the invitation, and nice to connect with you, Baxter and Samantha and Brian. Bye-bye.
Okay. No,
Bye-bye,
thanks a
Eithne.
lot. Bye.
So our next topic is how can we support others with mental health struggles? So the Irish Health Service recommends being there for them is massive, and they say that you can help by asking open questions about how they're feeling, talking about your own concerns and things you might have noticed, giving them time and space to tell you about what they are going through, and listening without being judgmental or offering solutions. And then after listening, deciding perhaps if you need to encourage them to get professional help. So with that said, I'll hand it over to you, Samantha.
Brian, I really like that summary that the HSC distributes to support people, to support others, and it should work very well. So most of us would know that the people that we're around, whether we have very loose connection with them, so it might be in the workplace, for example, or very close connection, so a family member or a very close friend, we might notice when people have had an experience that might create difficulty, or when the person is experiencing some emotional difficulty, for whatever reason. And on paper, those things make sense, but I ask everyone listening to think, well, what skills do I have to begin that conversation? So how might I become someone who can ask someone to confide in me, to share with me the difficulties that they may be having? And what resources do I have to respond to that? So I really welcome, I'd ask people listening to have a think about that, and I'd encourage people to, if they feel that they might not have those skills, that there are many resources online or in books or in talking with other people that might enable them to have those conversations, which can be extremely difficult to have. And they become more difficult the more emotionally tied you are to that person that you're caring for. So those social supports, those social connections are absolutely crucial, but it's not necessarily the easiest task. I'd encourage everyone to do it, and I'd encourage everyone to think, what skills do I have and how can I get more skills? Because we can each develop, it's something you can develop, it's something you can learn to do, either from speaking with other people, like how do I support someone who's having difficulty, or you can read about. So I think that summary that you provided from the HSC is excellent, and it's not a caution at all. It's a reminder that to support someone else, you must be in a good position yourself, or have the skills to do it.
Okay. Yeah, I think she's quite on the spot in terms of how to support someone with having difficulties. What I'll add on that is that I think it's essential to have deliberate strategies not to sideline someone who is already having difficulties. Because there are a lot of more times when someone who has difficulties or mental health difficulties in the community is taken as an outcast. And by doing that, it means all the support which was supposed to be provided to him or to her might not be provided because this person is not regarded as one of your members. So putting in deliberate strategies to have this person close to you and then show him that you are ready to listen to whatever he's facing. I think it's important. And as you are showing that, taking him to possible organizations or agencies which provide, whether it's counseling or some other social support, it is also important. At the same time, it might also be important to link this person to some other groups of people, because there might be some other people in the community who are facing similar problems, and this person might be thinking he's alone in this problem. But linking this person to these groups of people might be of great significance, because this person will now know that, yes, I am facing this problem, but there are also some other people in this community who are facing a similar problem, and those people might also help him in how to manage, because possibly they have gone through that problem and they have been able to manage that problem. So providing support to that person might include linking that person to those other people in the community, apart from taking him to the hospital or taking him to some other community health care services. Yeah, thank you.
Thank you. Yeah, and just building on that point, then, in terms of what services are available for those suffering from mental health struggles, I guess. Just building on our previous point on how it depends culturally and depending on location. But I guess, Samantha, if you could speak, I guess, about here in Ireland, how the referral system might work, and then Baxter, if you could give your own experience in Malawi. So just, I guess, what services are available in terms of going to your GP to get help, or getting help without talking to your GP, or getting help through your work, or be it from your school or college, and just, I guess, how mental health referrals work.
You've kind of described a number of different situations that might vary according to the person. So if I think about a college student in Ireland, might be able to have access to student health services, and they may have a range of services from more kind of triage or immediate responses all the way through to putting someone on a waiting list for more if someone needs more intensive support. Often for most people in the community, though, the first port of call tends to be their GP, their doctor, and who might respond to something that the person, as the patient, is saying, or who might have an observation, and then they would be maybe referred to services. And of course, on top of those more formal things, and there's enormous pressure on the services in Ireland. Baxter, I'm not sure if you know of the Irish context, but we have many people who are asking for mental health services because they're experiencing difficulty, and there's very long waiting lists and a lot of demand for services, and that's creating its own pressures. And I think it'd be remiss of me not to acknowledge the difficulty that people find themselves in when they have been told that they need a service, and then that service may not be available for some time. But one of the things that I think has the potential to transform and is having transformational effects in some capacities is digital health, and being able to have support services, and that might be patient networks or peer support type groups. And Baxter, you mentioned some of those about, maybe if I think about people who might attend, I don't mean group therapy here, I mean group support. And so those kinds of ancillary, additional community-centered supports are of equal, if not perhaps more, importance at the moment for people in Ireland seeking mental health support because of the enormous pressures on our system. And when I think about the numbers of people that are waiting to see a professional, a clinician, either for an assessment and a diagnosis or for some therapeutic intervention, I'm extremely concerned about the numbers of people that we would have who need a service and aren't getting it from the system, the health services executive. But on top of, in addition to that, we do have, I think we're very fortunate in Ireland, is that there are a number of patient-run, community-run, large-scale systems that might run online or run in sports clubs, for example, where there's lots of neighbourly or community type support, but that wouldn't be suitable for someone who has clinical levels of mental illness. So someone who might have a diagnosis where they need much more intensive support. But it's certainly great when we think about the mental health of our communities. How do we support people in those? So that referral system, in theory, should work brilliantly, and in practice we have many more people needing support now than we have ever had over the last few decades, and the service at the moment is unable to meet the demand. That's a real challenge for all of us.
Okay, in terms of Malawi, mental health support services, we have a variety of them. First of all, I'll look at the public one. We have the government hospitals, which provide support and mental health services. So we have the government, and then we have like St. John of God, which is under the Christian health services. Then apart from that, we also have a number of private practitioners. So a lot of people have opened up now their services. We have a number of psychologists, counselors who have opened up, and they are providing mental health services to people with mental health problems. But then there are also some other groups of people who are able to meet, and like the Alcoholic Anonymous groups, they meet and they discuss issues pertaining to their problems. At the same time, we also have in the communities, there are also some clubs. People, okay, I'll give an example. Like St. John of God initiated formulation of clubs in secondary schools as well as in the community, where people are able to meet and discuss much that they might not be suffering from mental illness, but they are just providing support, trying to prevent mental illness from the youth and from the community in general. So we have these services which are being provided to people here in Malawi, starting from the government, hospitals, as well as the private institutions, where people have opened up to provide counseling services and other services to mental health people. Yeah, thanks.
Yeah, thank you very much. So just moving on then to, I guess we've pretty much touched on them just there, but what treatment options are available for those with mental health difficulties? So in terms of psychotherapy, medication, and support groups being the three main ones, we have touched on them just before. So if you're happy to move on, if you're happy to speak on them, that's perfect. Or if you want to move on, if you feel like we've already touched on them, that's great. But I'll give you the opportunity to build on those three treatment options and your own experiences with those.
Yeah, I think those have already been explained. Maybe my colleague Samantha might add.
I was going to say exactly the same thing, Baxter. I think we've probably covered that, and
Yeah,
you gave a
perfect.
very neat summary too of the community groups, which I think are a really crucial part of that. So yeah.
Perfect. So just moving on to our penultimate question then is, what tools and techniques there are to overcome stressors in daily life and promote resilience in those suffering from mental health difficulties, but as you said, Samantha, perhaps not on a clinical level. So some the mental health charity Mind in the UK have a few ideas. So I'll just mention them briefly, and then I'll hand them over to you to give your own additional ideas. So the first one is be kind to yourself and developing and fostering self-compassion. Another one is try to find time to relax and recharge, I guess, your internal introverted battery. And developing your interests and hobbies is also supposed to be very important, which I guess speaks to your point, Baxter, just there on the clubs being developed by St. John of God in Malawi. Another one is spending time in nature, looking after your physical health, so ensuring you're getting enough sleep, staying physically active, and eating a balanced diet can and has been shown to make stress much easier to manage. Building your support network, identifying triggers, and organizing your time has also been shown to be very important. So with that said, I'll just hand it over to you, Samantha.
Yeah, they're all critical and very, very important parts in terms of supporting people to live the best life that they can. And I wouldn't quibble with any single one of those, but just to flag something I said kind of at the beginning, and that both Baxter and Eithne have talked about, is the role of context here. So we recently worked on a research paper, a publication looking at the role of nature. So one of the things that is recommended is that you get out and and you be in green space or blue space, so close to water or close to greenery, and the benefits that that can have for mental health. Not everyone has the same levels of access to those kinds of places, but one of the things we worked on is that, does it matter what you're doing there? So is a walk in the park once a day the equivalent to living in a neighborhood which has lots of trees? And so there's some intricacies here which I think would be useful for us to tease out. But the activities that you've described, I think, are a core part of any good life. And when I say good, I mean healthy life. And they will always support a more positive daily life. When someone's experiencing mental health difficulty, though, whether that's clinical or subclinical or extreme difficulty, sometimes those things, even in combination, aren't enough. For most people, though, that are managing the demands of, say, it may be the loss of a family member, or a period of illness for themselves or a loved one, or worries about their financial circumstances, those things can help kind of nourish them and support them to have some balance. And I think they're critical. But I do want to draw the attention back to the idea of context and the broader neighbourhood, the idea of, the social determinants of mental health, about our access to resources, the equity and equality in the communities that we live are an important factor as well. So all of those things are brilliant, but they all position it with the responsibility of the person to do those things. And we have a community responsibility to have our neighbourhoods and our communities set up in ways which support people's mental health. And so I agree completely. And I think that, and we live in communities, and communities have a responsibility to their individuals to support them.
Yeah, I agree totally again with what Samantha has just said. Just to add on that, I think it's necessary that we encourage people, first of all, to love themselves. Why I'm saying loving themselves is sometimes there are a lot more times when we get worried with what others do and what will happen to others, forgetting about ourselves. And because of that, because we forget about ourselves, we land into mental health problems. So encouraging people to love themselves, and in so doing, we need to encourage people to have time when they can have fun. By having fun, that time they forget a lot of worries, because usually I say, as long as you are still alive, you can't prevent yourself from not having stressors around you. Stressors will still come, but having time for yourself, having fun, is necessary, so that at that particular time, you forget about all those stressors which come across you. And the other thing is encouraging people to get involved in doing exercises, because at the time they are doing exercises, at that particular time, their mind is focused on the exercises, and they forget about a lot of things which can be able to stress them. And in so doing, they are being helped mentally. It's also necessary to encourage people to have a good diet, because sometimes having a good diet helps someone to also to also develop some immune system in the body, which can as well prevent that person from diseases which can stress you up, and then in the end have mental health problems. Encouraging people to understand the symptoms, the first symptoms of mental illness. People should be able to know that if I'm failing to sleep, this is a problem. I need to seek services, mental health services, as soon as possible. If I don't have appetite, this is something which is not good, and I need to seek some mental health services. If I'm having possibly depressed feelings, this is not normal. I have to seek mental health services. So people should be able to know the first symptoms, to say, okay, if I'm having these symptoms, before it's too late, let me seek mental health services. It might be counseling, or it might be maybe talking to someone else, but it's necessary that people should be able to understand and acknowledge that this is not normal. If I used to sleep so many hours and this time I'm failing to sleep, what's wrong with me? Then I need to go and seek mental health services. Yeah. So basically, that's what I can just add on what Samantha said. Thank you.
Yeah, thank you, Baxter. And Samantha, they're all brilliant points, I think. And just to conclude our podcast then today, I just put it to you, if you have any closing remarks or any additional comments that you would like to add to kind of supplement or wrap up what we've covered so far today on the topic of mental health.
I think we've covered so much ground, and I'm going to leave this or end this podcast with lots to think about, both from Baxter and Eithne. It's always wonderful to talk with people who work in the area, and both in kind of in different regions and having a different focus. I think in summing up, I'd like any listeners to reflect on how they care for themselves. How I love the idea, Baxter, that you said about like having some fun and being active. And there's so many of the things that we do in daily life for, sleeping, eating, daily movement. It doesn't have to be exercise, but daily movement, getting up and being around and being socially connected can do so much for our individual mental health and the mental health of communities. And so I'd like to remind people of the importance of those daily practices for their own health.
Yeah, and with me, what I need to say is that first of all, we need to understand that a human being is a social being, and being a social being is supposed to be connected, just as what Samantha said. So you need to be connected to other people. So I would like to encourage people to find a friend, at least talk to a friend, find someone whom you can confide to. Don't keep things on your own. If someone keeps things on their own, the end result is that they're going to come out in a negative way. So it's necessary to have a friend, to have people they can chat with and get connections. It might be in a family, it might be in a society, it might be at the workplace or wherever. And also find some hobbies, maybe whether it's watching soccer, whether it's watching TV, singing, all those things, which can help you have time to relax, other than every time being very busy. We have a lot of things which demand our presence, but then those things will still be there even if you are gone. So people need to know that your presence is important, but at the same time, if you are dead today, it doesn't necessarily mean that the world is going to stop, to be on a standstill. The world is going to continue running even in your absence. So bearing that in mind, we need to have time for ourselves as well, because we know that I should be there, yes, but even in my absence, the world is going to continue. So have fun to yourself, love your family, and life goes on. Mental health is very important because you can't be healthy without mental health. Thank you.
Thank you very much, Samantha and Baxter and Eithne, for joining us today on this episode of the Prime podcast series. I learned loads myself, and I've really enjoyed speaking with you. I think just one big takeaway I took was that idea. I think it was Baxter, you mentioned it earlier, that you have to look after your mental health first as well if you want to support others. It's like that idea in an airplane. In the event of a crash, you have to look after your oxygen supply first to be able to help others. So just to make sure, like you said, Baxter, to check in with yourself and take that time to engage in mental health, positive mental health promoting behaviors such as play, and engaging with social interaction. Little things, as you said, Samantha, which go a long way to ensuring and promoting mental well-being. So yeah, thank you very much again for joining us, and I'll just leave it there. Thank you.